Hello, welcome to Western Wisconsin. What's going to follow is an introduction to our organizations. All three of our organizations are excited for you to understand our capabilities as a transitional care unit, and I'm confident that we can meet the needs of not only the patients themselves and their family members, but to the high expectations that you have as you hand them off. You want to ensure that they continue to receive the same level of care that you were able to provide, and I'm confident we can meet that challenge. You see, we're all in it together. We're all guided by the same mission, vision, and values, and we all come to work with the same focus that each of you do. We want to deliver on the triple aim, give our patients and families an exceptional stay, focusing on quality, and making sure that we provide a great setting for the patients themselves to heal and get back to home.
We had a unique patient story within the last year where a patient, an elderly gentleman, fell down the stairs at home and suffered some injuries. He was initially seen in our emergency department, then transferred to Lakeview Hospital for some specialized orthopedic care. He developed complications there and was transferred to Regions, and after quite a lengthy stay at Regions, a referral was made for him to finish his recovery in transitional care, and he came to us here in Hudson. And we were so glad to receive him back, kind of see that full circle of care, and he's doing well now and is a volunteer here at our hospital. Our nurses typically are taking care of 3 or 4 patients. So here we have a certified recreational therapist who individualizes programming. We have healing touch, pet therapy, befriender care, aromatherapy, music therapy, and other programs. We also offer spiritual care services to patients to meet their spiritual and emotional needs. We do have one primary therapist, and she typically sees patients a couple times a day on a daily basis. We think that provides great continuity of care for patients, and she gets great reviews from our patients. Right on our campus, we have Health Partners Clinic Hudson, which offers outpatient services, including up to 25 specialists who are here. We're just beginning our relationship with the new Woodland Hills Senior Living Campus, just right on our property here, along with the DaVita Dialysis Kidney Clinic. So patients who need transitional care can do their recovery on our transitional care unit, just as they would if they were out in the community here. One of the payers that we are not able to contract with for transitional care is Wisconsin Medical Assistance. Medicare patients and other private payers are insurance plans that we are able to work with. We do also offer respiratory care services, and we have several respiratory care therapists who work with patients. As a social worker, I enjoy seeing patients come to transitional care because it's a different option than a traditional nursing home setting in the community. And for some folks who have had pretty high complex medical needs, it's a nice transition. It's a nice opportunity to prepare to go home yet have that close medical monitoring. And we love taking care of patients from our community. We just love seeing them come back and help them complete their recovery and return home.
We are a 25-bed licensed critical access hospital, and on our med-surg floor, we are designating 4 beds to our TCU. The patients that are qualifying for that service are those that are in need of skilled nursing, including IV antibiotics or wound care, physical therapy, occupational therapy, and in addition to those therapies, speech or cardiac rehab may be in combination with those that are qualifying.
The Cancer Center of Western Wisconsin is located on campus here, offering radiation therapy, which I think is really unique.
Just to really highlight the Cancer Center being a part of our campus and those patients that are in need of TCU and radiation, I mean, it's just really been a huge blessing for us to have that in our community. So something that we're really excited to offer.
We do have recreational therapy as well in more of a less structured role, but offered by our occupational therapists. We have a new service, music therapy, starting soon, so we're really excited about that too. We have a physician in-house 24/7, which is great, and then our primary care clinic is right here on site as well, so I think that's a great benefit for your patients coming over here. We're proud of the care provided at Westfields, and I can speak for myself that it's definitely a place where I feel comfortable having one of my loved ones get care and rehabilitation.
My mother had some extensive medical care and was in need of TCU, and she took advantage of the services, and it was very important for her not to be in a nursing home setting, but more in the acute setting, more comfortable for her. So that was really a great service we were able to provide.
Amory Hospital is a 25-bed critical access hospital located in Amory, Wisconsin. We average 1 to 2 transitional care patients on our unit each day, and our average stay is about 7 to 14 days. We have expertise available to us from our wound healing center and from our behavioral health unit, which are both located in Amory. And we have inpatient rehab services, and they have a workroom area where they have access to equipment. Also, OT has a kitchen area where they can help people to transition back to returning home by doing cooking. We are unfortunately unable to accept Medicaid patients in transitional care, but we certainly work with Medicare patients and private insurances. We have a large primary care clinic in Amory with specialty care available. We have 3 outreach clinics in Clear Lake, Turtle Lake, and Luck, Wisconsin. We also have 2 fitness centers. For rehab, we have one in Luck and one in Amory. They both offer rehab services for patients locally. We also have specially trained wound physicians and nurses available to us. We have a 10-bed inpatient behavioral health unit. It's a geriatric unit, 55 and older. We have chapel available on campus, and we have a full range of lab and x-ray services available, and our occupational therapists and our CODAs work with patients to develop recreational plans or activities while they are here.
I hope you enjoyed learning about our organizations. We look forward in partnering with you to continue providing the care that we've done for so long and that we will continue to do. As we're guided by the same mission, vision, and values, we're up to the challenge, and we understand the expectations that come along with the trust that you put in us. So remember, we're your partners in the Valley, and if there's ever any questions or concerns, we're available. We look forward to meeting the needs of our patients living in our communities together. Again, thank you.